Good morning, guys. I'm just about to take my medicine. I'm not feeling that great this morning. Now, anyone who's been watching knows that I dropped 1 milligram on Monday down to 24 and didn't think I would feel it. I don't feel it much, but what I will tell you is that both yesterday afternoon and this morning I have had like a never-ending faucet running out of my nose. Like, there it goes again. It's embarrassing. It just runs right out my nose and into my mouth and down my chin if I don't do anything about it. It's not the kind of sniffery that you can sniff back up in there. I don't know. Sniffery. It's not the kind of snot that wants to stay inside. Yes, I always lick the foil because addicts need every single bit. And then I also usually rinse my bottle out 3 times, sometimes 4, depending on the way it smells. That is also letting every last drop that I can feel get into the back of my throat. I also actually read one time online, I don't know if it's true, but it wasn't like a person telling me this. It was like an article talking about tapering and where the methadone gets absorbed. Because sometimes when you get at a really low dose and you still have that weird methadone flavor in your mouth afterwards, you start to wonder, is there still methadone in my mouth? And if there is that methadone getting absorbed? Because it was my understanding that methadone gets absorbed in the stomach, the intestine, and eventually, the metabolites and stuff get to your liver. Their answer to that question was yes. Methadone does get stuck in your mouth. And no, your mouth will not absorb it, but how you will absorb it is throughout the day. Your saliva will eventually get it down into your stomach. To me, that sounds like a crapshoot. To me, that sounds like when you're at a really low dose, you're at risk of basically losing 0.5 milligram to 1 milligram of your dose, like for careless reasons, which sucks. I don't really know what the solution would be. I mean, they use these machines to dispense the medication, and we have to trust what's in the bottle, and then we have to try and get everything back out of the bottle that we can. It's just how it goes. Anyway, feeling okay today. Feeling tired. I'm feeling very tired, even though I slept a little bit. Probably because it's 7:40. I've been up since 5, but this is what I'm talking about with like having problems that you have to deal with on your own and how they get overwhelming. The other day I was outside gardening and I noticed that I've got a crack in my foundation. But I have a brand new house. So, and not only is it one crack in my foundation, there are several cracks running along both sides. And it's not just a crack, it's like a piece of the concrete has come off and you can access this weird pushy foam stuff inside. It's almost like if concrete were to rot away. That's what it would look like. I'm sure there's some like reason that it's like that. Maybe they sprayed foam and covered it with concrete. I'm not sure, but as somebody that knows absolutely nothing about construction, it's alarming to me when I see the concrete cracking off my foundation, exposing foam underneath. So, got somebody coming over here in 20 minutes at 8 a.m. to check it out for me. And I actually need him to do several things for me because he's kind of like, well, he does a lot more important things than handyman stuff, but he has a son that he'll also help out with like handyman type stuff. My God, and I really need a handyman. I have so much stuff that needs to get done around my house that I know that I have the capability to do it if I like sat down and YouTube taught myself, but like I've told you guys before, it's like my time and energy and everything is just focused on my taper right now. And when I start thinking about larger projects, it doesn't distract me from my taper. It's like it does the opposite. It just overwhelms me because I feel like, I don't know if it's the ADHD, because I do have, well, whether you believe in it or not, I was diagnosed with ADHD. That was my first diagnosis as a teenager. And I do have a lot of issues with things like time blindness and also feeling like if I have something to do at like 4 o'clock in the afternoon, but nothing else before that, I have this weird problem where like I can't do anything else with my day until 4 o'clock. So I could have like a dental appointment, right, at like 3 p.m. But no other plans that day. And a friend could call me and go at 11 and go, hey, let's go grab, a smoothie or something to eat. And like my immediate panicked response would be, oh my God, I can't do that. Like I have a dentist appointment at 3 o'clock. And of course, their rational response would be, yes, you can. Like, this isn't going to mess with that. It'll just fill your time until then. But my ADHD brain is like, there's no such thing as filling time. Like, you either have something to do or you're waiting for something to do. It's complicated, and I'm sure it's also contributed to my addiction because I'm sure it contributes to like my anxiety around a lot of different like social activities, basically. I'm trying to remember if I've gotten everything off that I wanted to mention. Oh, I got blood work done yesterday, and I told you guys about how blood work is like my worst nightmare. But praise the universe, this woman that works at REX Labs was there. We know each other. She smiled, like she was like, I know it, girl, I got you. She's been getting my blood for the past 10 years, and every single time I see her, I tell her, Sonia, you would never believe, like the last time somebody tried to get blood for me that wasn't you. Like I told her about like the IV team failures, like with my colonoscopy. I told her about how they had to get me in my neck when I had my ankle surgery. Like she was just like flabbergasted. She was like, this is crazy. I'm like, why don't you work on an IV team? Because you're clearly so special at what you do. She said, I'm special because I listen to my patients. And if you tell me that you've got scar tissue right there, I'm not going to sit there and argue with you about it. And my God, anybody Any IV drug users out there that have issues getting blood taken know what a gift that is to be given by your phlebotomist, because how many of us have had them pressing on our arms up and down, going, oh, maybe I feel something here, oh, maybe here, oh, what's this, right here, right here, I feel something hard. And you're sitting there going, yep, and it's scar tissue, and please don't stick anything through it because it's gonna hurt like fucking hell. And then they look at you and they go, no, I got it. I've been doing this for, 15 years. And then I don't have to tell you how that story ends. They don't get it. Anybody having trouble with getting labs done, go to the hospital. Those women are trained better. They apparently listen better, because honestly, the whole team at the lab place where at my hospital anyway are just so compassionate and non-judgmental. Like, you can walk in there and tell them everything, tell them your story. Look, this is why I'm hard to stick, and you're not going to be able to get me here, or in my foot, or here, this has been blown, I can't feel my hands. Like, they want to know it all because they want to help you. And they had to get 17 vials of blood from me yesterday, which is a lot. It's not enough to like make me feel crappy, but it's enough to, although I did feel a little tired, it's enough to potentially collapse that vein. And if she had just inched or moved or twitched the needle at all, she probably wouldn't have gotten all that blood. That's the other thing that I've had phlebotomists do. They'll stick me in the vein that I tell them will work, and then they'll get a blood flash, but then they'll let go of it before they tape it down or anything, and they'll just like let it flop around. And then next thing you know, oh, the vein won't give any more blood. Well, gee, I wonder why, because you just like twisted it into like 3, wrung out towels and then let it flip back. I just am continually flabbergasted at the education of the people that actually take care of the world. And I am also continually shocked at the compassion and kindness that you can get from people whose only quality that's different than any of those idiots and assholes is that they have ears that they don't use to hear things, but they use to listen to people and make choices based on listening. It seems so simple. All right, so hopefully another second goodish day. I think we should know if the drop really hit me or not by tomorrow, so I'm feeling good about it now, though. I'm feeling good about it now. Doesn't mean I'm going to start rushing it again, but I'm good right here, right now at 24. Yes, I am. And I guess I'll talk to you guys later, because now I got to go talk to this foundation guy. I mean, anybody out there know? Is that normal? Is it normal to be able to like poke through the concrete? I have my foundation is like a flat concrete foundation. I forget what they call it. Like, I don't have a basement or anything like that. It's on a concrete slab. Is that normal? to be able to eventually like take a rock and knock away at the concrete, at the slab, and like access some kind of softer material inside seems strange to me. I guess I'm about to find out. In fact, I fucking think I just heard his wheels pull up outside and I ain't got no pants on. So yeah, bye.